How soon after an abortion can one undergo a procedure to clean the uterus?
Hello everyone. Welcome back to our channel. Today, we will be discussing an important question. How soon after an abortion can one undergo a procedure to clean the uterus? If you or someone you know has recently undergone an abortion and is curious about the timeline for a uterine cleaning procedure, you've come to the right place. Let's dive into the details.
Understanding the uterine cleaning procedure.
First, let's briefly understand what a uterine cleaning procedure involves. After an abortion, it is natural for the body to expel any remaining tissue or products of conception. However, in some cases, the uterus may not completely empty on its own. In such situations, a medical procedure known as uterine cleaning or uterine evacuation may be recommended to remove any remaining tissue and ensure the uterus is clear.
Timing for uterine cleaning procedure.
So, how soon can one undergo a procedure to clean the uterus after an abortion? The timing for a uterine cleaning procedure can vary depending on several factors, including the type of abortion performed and any specific complications that may have arisen during the abortion process. In general, medical professionals usually advise waiting for a period of time after an abortion before considering a uterine cleaning procedure. This waiting period allows the body to naturally expel any remaining tissue and for the uterus to heal.
Recommendations for different types of abortion.
Let's look at the recommended timing for uterine cleaning procedures based on the type of abortion performed. 3.1. Surgical abortion. If you underwent a surgical abortion, which involves a procedure to remove the contents of the uterus, it is typically recommended to wait at least 1 to 2 weeks before considering a uterine cleaning procedure. This waiting period allows for the initial healing of the uterus and reduces the risk of complications during the cleaning procedure. 3.2. Medical abortion. For those who underwent a medical abortion, which involves taking medication to induce the expulsion of the pregnancy, the timing for a uterine cleaning procedure may be slightly different. It is generally advised to wait approximately 2 to 4 weeks after the completion of the medical abortion process before considering a uterine cleaning procedure. This waiting period allows for the body to expel the pregnancy tissue and for the uterus to recover.
Consultation with a healthcare provider.
It is crucial to consult with a healthcare provider to determine the best timing for a uterine cleaning procedure after an abortion. They will be able to assess your individual situation, take into account any specific complications, and provide personalized advice tailored to your needs. To summarize, the timing for a uterine cleaning procedure after an abortion can vary based on the type of abortion performed and individual circumstances. Generally, it is advisable to wait 1 to 2 weeks after a surgical abortion and approximately 2 to 4 weeks after a medical abortion before considering a uterine cleaning procedure. However, it is important to consult with a healthcare provider to get personalized recommendations based on your specific situation. We hope this video has provided you with helpful information. If you have any further questions or concerns, please reach out to a healthcare professional. Thank you for watching, and we'll see you next time.